And welcome back to the Morning Blend. There's no doubt we are facing a local and national nursing shortage, and even more significantly, there's a lack of help in mental health care. The Milwaukee County Behavioral Health Division is taking this problem head on, and it has a mission to find the right people who have what it takes to care for the most underserved population.
We're here now with Mike Lappen from the BHD, along with Jeff Munz. He is a pediatric crisis services manager and also what they call a second career nurse. Previously, Jeff spent 20 years in the construction industry. I love that change.
It was quite a change, let me tell you that right now. I enjoyed what I did previous to this, but when the construction industry kind of took a little bit of a lull, I went back to school, discovered nursing, and it's been a great opportunity for me. So.
Love that.
It's so cool. I think that's really neat.
Let's talk about behavioral health in general and exactly what it entails.
So at the Behavioral Health Division, we serve individuals who are struggling with mental health or substance use challenges. We like to look at it as really part of health. So everybody has behavioral health, just like everybody has health. So on any given day, someone might have a challenge with anxiety or depression or adjusting to some drastic situation in their life that becomes unmanageable, and they might need inpatient care at our facility, and they come and get treated by folks like Jeff.
Yeah. That's fantastic. It's got to be a lot different to be a nurse for a mental health facility rather than a regular RN that we might see at an average hospital or place like that.
So when they walk through our doors, our first focus is obviously going to be behavioral health. But we are there to really treat the whole person. So we're going to look at their medical issues as well as their behavioral health issues. And we're going to focus mostly on the behavioral health. We have to make sure that we're taking care of the needs of the body as well. Mm-hmm. So it's not like we're separating the two. We have to take care of everybody equally and take care of all things inside that body equally. So
yeah. It's Mental Health Awareness Month, and that's an important issue. And for you guys, working with youth, kind of just tell us a little bit, what age frame is that and what's the difference of working with youth versus adults?
So youth obviously means just that. Anything, we have had patients that have walked through that have been very young, like 4 or 5 years old, generally on our inpatient units from 7 to 18.
Okay.
We're dealing with the growth and development of children in general and just making sure that they can adjust through the normalcy of life in everyday living. When they don't have those normal things every day, that's when we have the trauma that might be associated with different types of children, and that's where the behavioral issues come in. So.
And what kind of normal things? Food?
Yeah, so we're looking at homes that might not have proper heating or food and nutrition for their children, or the home might have different types of issues going on with substance abuse or alcohol abuse. So anything that is going to cause trauma to these children, those are the type of things that we're going to treat and try to work our best to help them recover and stabilize their lives.
Yeah. We mentioned a nursing shortage that's an issue not just here in our community but nationwide. You're hiring, you're looking for qualified people who I would think have the desire to give a special kind of care that I think would probably require more patience and some other things. What type of candidate are you looking for?
I think the candidates that we're going to be looking for are the ones that can help us with relating the stigma of mental health disease and how it kind of affects the whole community. So they have to be compassionate. They have to have a strong desire to run into the fire, the crisis situations, and work with those types of patients. But they also have to have the understanding of how to work with the stigma associated with that mental health disease. And so we will sit back and look for people that understand everything that it is associated with those types of things and help them to relay the message to the community as well as to the patients and the families.
Yeah, it's important work on your shoulders that you're doing. You know, and there's a lot of perks if you get hired. What's in it for those who become a nurse in your?
So we have a competitive signing bonus. We do assist people with student loan reimbursement. But I think the most important thing to mention is that you will learn more in our environment than you're going to learn in any other treatment environment serving people. We serve the most challenging folks. We don't turn anybody away. Mm-hmm. And so that knowledge will go with you the rest of your career as a nurse. So whether or not you stay with mental health nursing for the rest of your career, you will have regular contact with people who are struggling with mental health and substance use challenges the skills that you learn in our facility will be invaluable forever.
Yeah, absolutely.
It's so much about treating the whole patient, which I think is fantastic. If people are interested in applying, there is a fair coming up, so people could go ask questions, find out more information, see if they might be a good fit for this type of job, right?
Exactly. So we have a job fair on Tuesday, May 15th, and several of the managers, like myself, will be there to answer questions and kind of help guide people through the process of applying. And I think that gives people a better understanding of what we're going to be doing to actually come and talk to us and get their questions answered as well. So please stop in. That's on Tuesday from 2 until 5 at our facility.
That's
wonderful.
Great. All right, so here it is, the Nurses Job Fair coming up. It's Tuesday, May 15th. It's from 2 to 5 p.m. You can learn more as well by visiting this website. It's Milwaukee.gov/nursing.
You guys are located off of Watertown Plank. Are you near the medical college in Fredert? And
Correct. 9455 Watertown Plank.
Fantastic.
Thanks, you guys.
Thank you
very much.
Appreciate it.